Diana Mumbe worries about her future. Since she was diagnosed with HIV, she has remained in treatment, living a healthy, productive life.
We used to receive supplies of medication to last us a few months, but that doesn't happen anymore because they are trying to share the available drugs with everyone.
In Kenya, an estimated 1.3 million people live with HIV, the majority of those on treatment thanks to sites such as this one. However, the World Health Organization warns that the US funding cuts could lead to a rollback in the gains made in the fight against HIV and AIDS on the continent. Located on the outskirts of Nairobi, the Reuben Health Center is a faith-based non-profit organization which serves hundreds of patients, some living with HIV. 3,752 treatment sites like this have been at the forefront of tackling the virus in Kenya, but since January, US-funded HIV treatment and prevention programs have received stop-work orders.
We have a partner, they are called Faharia Jamii, who are funded by USAID, and they have been supporting us for the longest time, since the inception of the clinic, with the comprehensive care unit in terms of staffing. Sometime early February, they got an order that they should proceed for unpaid leave indefinitely. We've retained a few just to keep the services running, but we don't know how the future looks like.
In Kenya, approximately 41,000 doctors, nurses, technical staff, and community workers were supported by US foreign aid, according to UNAIDS. The funding cuts could lead to over 10 million additional HIV cases and 3 million HIV-related deaths globally, the World Health Organization warns. Across Africa, there are currently over 25 million people living with HIV. Countries are now adapting to the cuts, exploring ways to continue providing critical HIV services.
We were looking at 2030 having no new infections, that the ones who are already infected, they are all on treatment and are virus suppressed. That's why the prevalence rate has dropped. And we would like to retain that. We would want by 2030 to really achieve that goal.
The Kenyan government asserts that for now it has adequate stocks of HIV medication, but the future remains uncertain.
In order for a HIV-positive person to survive, to raise their children, have a family and live well, they must remain on their medication. The government has a responsibility to step in now.
But for now, people living with HIV and AIDS are hoping that a dose of hope will come soon. Wilkis Anyabwa, CGTN, Nairobi, Kenya.